Karina, shall we get started? All right. Well, welcome everyone. We're so happy to connect with you here today for Gear Up for Civic Health Month. I'm Cynthia Mahoney of Voting for Climate and Health, and I'm here with my co-leads, Margie Chen. You want to say hello, Margie?
Hi.
And Karina Maher. Karina, you want to say
Hi,
hello?
welcome.
There we go. Before we dive in, a few housekeeping messages. Please introduce yourself in the chat with the name and city where you work, and share a few words about what you think when you hear the words civic engagement. Karina will be monitoring the chat, and feel free to post questions there during the webinar that we'll try to address during the panel Q&A. We will be sending the recording, all of the links and action resources in an email to everyone who registered over the next few days. So first, a few words about Voting for Climate and Health. We're a relatively new organization that spun off from Climate Health Now, which is the California state affiliate of the Medical Society Consortium. Our mission is to highlight the connections between voting, climate, and health, and activate nonpartisan civic engagement in healthcare settings to improve the health of our patients, our communities, a life-sustaining planet, and provider well-being. We want to see civic engagement integrated into healthcare to make it the norm. So today we'll be going over just a little bit about our story, talking about Civic Health Month, the why, the how, and what your institution can do and how you can help, followed by a panel Q&A for 5 to 10 minutes, depending on how much time we have, and then our closing. So we're proud to partner with Vote ER, a nonpartisan civic engagement organization that focuses on healthcare. We're excited to celebrate Civic Health Month in August and share with you this perfect opportunity to get our institutions engaged in civic health. It's a month-long advocacy campaign to increase voter registration and promote voting as a tool for creating better health outcomes. Civic Health Month had over 300 partner organizations and associations in 2022, and with your help, we hope to see many, many more in 2023. I think of it like National Voter Registration Day, but it specifically highlights the connection between voting and health, and our unique role as health providers and connection to patients who may be the most vulnerable to things like pollution and climate change, and yet often are less civically engaged. Before I dive into Civic Health Month, I'd like to share a little bit about how we got here. When Climate Health Now formed in 2019 to activate the health voice for climate advocacy, we certainly didn't expect in 2023 that we would be talking about the connection between health, civic engagement, and democracy. But in 2020, COVID struck, and we saw that the act of voting itself could be deadly, like the super spreader event in Wisconsin. We stepped up to form the Healthy Voting Team, joining with colleagues across the country, and we were successful in placing op-eds in many states that helped make voting trusted and accepted by our patients as the healthy way to vote. The 2020 election was safe, and we thought we could retire the team. But 2021 ushered in an onslaught of voter suppression and an assault on democracy aimed at disenfranchising our most vulnerable patients. We reconstituted as the Voting for Climate and Health team. And over the last 2 years, we've learned a lot. We've learned that the majority of our health is outside our one-to-one medical care, no matter how good it is. Instead, it's related to socioeconomic factors, the social determinants of health, and the environmental determinants of health, like climate, which is only getting worse. We all know that. We've also learned that voting itself is a social determinant of health, a structural determinant, and that threats to democracy are threats to health. Not only that, but the corporate forces driving climate change are often the same ones trying to silence our patients' voices, and that when patients are voters, their health improves. We realized that we can't solve the climate health crisis without a healthy democracy where all voices are heard in free and fair elections. And I'm happy to say we're not the only ones who've come to this conclusion, that civic engagement is becoming mainstream in health. The AMA passed a resolution that voting is a social determinant of health. The Healthy People 2030 included voting as a core objective. And medical schools and societies are now teaching advocacy and civic engagement as a climate solution. So you may be asking yourself, how do we know that civic engagement really matters for health? Is it something that healthcare institutions can and should do? And what does civic engagement in healthcare even look like? So we're here today with our partners, our allies from Healthy Democracy, Healthy People, AltaMed, and Vote ER to answer those questions and to help you bring your institution on board with Civic Health Month. A great first step to creating a world where civic engagement is the norm in healthcare. So first off, I'm very pleased to introduce our first speaker, Gnora Gumanow, who's the Partnerships Director of Healthy Democracy, Healthy People. Gnora, would you like to share your screen?
Yes. That working? Where is it? Okay. Yes, hi, everyone. Great. So just a little bit of background. Healthy Democracy, Healthy People is dedicated to building our collective capacity and power to realize health and racial equity by strengthening democracy through inclusive civic participation and voter participation. And it's really rooted in the definition of health, public health, which is what we do collectively to assure the conditions in which all people can be healthy. And we use this framework to explain or discuss the relationship between democracy and health. We know in public health that our power to influence, our capacity to act and shift the social determinants of health or policy conditions for health can lead to better health outcomes. And better health outcomes actually leads to higher rates of civic and voter participation. So it's this constantly reinforcing and interdependent relationship. And we can see this relationship is true throughout historical examples. So many are listed here, but one that I really want to highlight is that during the women's suffrage movement, when women got the right to vote, that led to better investments in maternal and child health, which ultimately led to declines in child mortality rates by 8 to 15%, depending on how those estimates were determined. And so there's, this historical example of how when we organize, when we build power, and when we engage in democracy collectively, that can have a big impact on our health. And over the last 10 to 15 years, there have been peaks and valleys, high points and low points in our democracy, led by both the Supreme Court with, in 2010, Citizens United, and 2013, Shelby v. Holder, which gutted access to democracy and struck down large protections for voters and for campaign finance. But in 2020, we really rose to the occasion. States implemented and enacted sweeping changes to absentee voting, promoted mail-in voting, and that led to a huge number of people turning out. We had record turnout in 2020, and states have both learned from those lessons by expanding access to democracy, and also targeted those lessons by passing laws that restrict some of these expansions that happened in 2020. And what this really tells us is that there's a continuous struggle for inclusive democracy. In 2020, again, 66.8% of the people who were eligible turned out to vote across the political spectrum, across demographics, and that is unprecedented turnout. But 80 million eligible people still didn't vote, even in a year of unprecedented voter turnout. And since 2020, we've seen limits to campus and student voting access, limits to drop boxes, voting by mail options, voter ID. And so there's this continuous struggle, and we just can't sit out in order to achieve our aims for inclusive civic participation and health equity. And so we brought together a coalition of 11 public health organizations to really start to tell the story of how democracy and health are interconnected. And we started out by looking at the narrative and the research, which in 2020, we hadn't seen research in the United States. Most of the research comparing access to democracy and health happened at the national or international level, comparing countries to each other. And so our research compared 12 different public health indicators across all 50 states in the US, and their restrictiveness or ease of voting policies in each state. And what we found across the board, across all of these public health indicators, is that states with more voting access and greater civic participation had better health outcomes. And that actually some disparities around infant and child mortality rates decreased in states with better access to civic and voter participation. And so just to highlight this relationship here, this is our main finding and our main analysis, that overall health in each state is, on the y-axis. So you have better health as you go up the graph, worse health as you go down the graph, and then is compared by better access to voting on one side of the graph and less access to voting on the other. And you can see almost a completely linear relationship. And this makes it really clear to me and others that access to voting is tied deeply to our health outcomes and health equity. Just to walk through the Health and Democracy Index a little bit, we can compare and see how this relationship is consistent across a number of public health outcomes. And you're welcome to visit the Health and Democracy Index after the call and explore the indicators that you're specifically interested in. We also can see the different policies that impact voter access in the Health and Democracy Index and how they're related to the overall model. Inclusive voter registration, vote at home, voter ID laws, and voting rights restoration. And so we see our work as doing systems change at every level. In the organizational level, we can adopt policies to make it easier for our employees to vote, and also change the narrative and context for advocacy at the state and local level. We can join efforts as health professionals to promote state and local policies that expand voting access. And we've done that. Healthy Democracy, Healthy People has done that in Minnesota and Michigan, and are working to expand to more states in the next year. And then at the national level, we have used our research and narrative to promote voter registration and participation using our public health administrative levers like healthcare.gov, Healthy People 2030, and county health rankings and roadmaps. And so I just want to remind everyone on this call that health is always on the ballot, regardless of if you see a ballot measure that directly is about Medicaid expansion or health outcomes or investing in our public health infrastructure. You might see representatives, judges, other folks on the ballot that can make decisions about your health and the health of our communities. So it's important to pay attention in every single election, make a voting plan for yourself, and make sure that your friends, colleagues, and family have a voting plan. Promote opportunities for civic and voter participation across your workplaces. And really what we're here to talk about today is encouraging our patients and community to vote in every election. And also really encourage you to invite your colleagues to learn more, because the more health professionals that understand the relationship between democracy and health, the further we can get. And so a few opportunities to learn more about Healthy Democracy, Healthy People and our work in Civic Health Month are these two webinars. The first will be featuring Carter Blakey and Elizabeth Blomberg, talking about the practical approaches to strengthening civic and voter participation through public health. And the second will be about talking about the narratives, historical context around democracy, and what those implications are for health. And I will pass it back to Cynthia. Thank you so much.
Thank you, Nora. That was terrific. I think that Healthy Democracy Index is so impressive, and you can explore that and see what's really going on in your own state. It's quite amazing, state by state. So next, I'd like to introduce our friends from AltaMed to see how they celebrate Civic Health Month. Cynthia Romo is the Civic Engagement Program Manager for AltaMed Services, working through clinic administration. Dr. Ilan Shapiro is the Chief Medical Affairs Officer and Health Correspondent, and was actually a White House liaison for the Hispanic community. Cynthia, would you like to share your screen now?
Yes, and thank you, Cynthia M, for the beautiful introduction. Again, a big thank you to everyone here and the panelists as well and behind the work. And I see a few friends online as well, especially from San Ysidro Health, so big shout out to them. And very quickly, and I'm going to share a little bit who AltaMed is and why we do the work that we do. We're a fairly qualified health center. Our service areas are in LA and Orange County, but our campaigns do reach statewide. And we have over 500,000 patients that we have the privilege to provide health and human services, and also more than 4,000 staff. And again, we started very, very quickly in our DNA. Social justice is ingrained in this, and we believe that part of alleviating, our communities is also to make sure we address those social determinants of health that affect them. And I know I'm preaching to the choir here regarding that, but again, we have to make sure that our community participates in these civic engagement processes to have a place at the table. As you'll hear from Dr. Shapiro in a bit, he says if we're not at the table, we're the main meal. So we need to participate. In 2018, we established our integrated civic engagement program that engages our in-clinic staff, of course, our patients, and then also our community as well. So our staff, the majority live in the service areas that we provide resources to. I'm actually an AltaMed patient, so is my family, and I live in the service area here in Southeast Los Angeles. So big shout out to Southeast LA here. And of course, we work with our different partnerships, for example, with VODR and other partners statewide and nationwide to create these tools and these programs that can be easily implemented and replicated and scaled to engage our patients in our communities. One of our biggest campaign, and I'm wearing our campaign shirt, is My Vote, My Health. As Nora said, health is on the ballot. It is always on the ballot. So we stay true to our campaign of My Vote is also My Health. So this campaign, and you can learn a little bit more on our website, myvotemyhealth.org, or follow us on social media, is to engage our patients and our staff from underserved communities to be a part of the democratic process, to have a voice. And we do hear a lot of saying, well, I'm not into politics. Well, politics is into you. So we need to participate. And now I have the privilege of sharing a few words from Dr. Shapiro, who's a Senior Vice President, Chief Health Correspondent, Medical Affairs Officers. He's a big civic engagement champion. He has a VODR badge, voter registration badge. He uses it with his patients, and he celebrates August Civic Health Month. So I'll turn it over very quickly to Dr. Shapiro.
Thank you, Cynthia. It's a pleasure to be with you. My name is Ilan Shapiro. I'm a community physician, and I have been serving AltaMed for the past 7 years. And currently, I held the position of Chief Health Correspondent and Medical Affairs Officer. Part of my life is being a physician. I see patients, and sometimes I do get frustrated. And I do not know about you, but probably you have heard or been part of this story, where you have a patient, you prescribe them a healthy diet, do exercise, make sure that your mental health is taken care of. But when they walk out of your clinic, what happens? The economical pressures to actually get food changes, then the healthy choices are not the most economical, efficient way to do it. Or the exercise part. Maybe there's a lack of green spaces to actually move, or it's completely unsafe. Then this connection that we're having and something that we all know as social determinants of health is real. Then part of this movement of us as healthcare providers, and by us, it means doctors, nurses, mental health specialists, dentists, anybody that touches patients. And a big shout out to our promotores and promotoras, our community workers. They're just amazing and they know how to do this. We need to spread the message. The same way that we have been fighting pandemics, the same way that we are currently fighting obesity, the same way that we have fought against tobacco use. This is one of the most important fights that we have as healthcare providers. Moving forward, we can make a difference. You may ask, how can I actually, I'm seeing 20, 30, 400 patients a day. How can I involve thousands or hundreds of thousands of our community members to be part of something like this? It starts with us. One of the beautiful things that we have done in AltaMed, especially with our civic engagement department, led by amazing leaders, and I'm just going to name a few: Lisette Escobedo, Cynthia Romo, Jonathan, mi querido Roberto. We have a lot of people that have created a system that not only is measurable, but we can actually share it with other people. And right now, let me give you some numbers. The last campaign that it has created and was complicated with a lot of issues in the world, but they managed to get more than 500,000 community members. They heard the message. Mi voto es mi salud. My vote is my health, because it's real. Every time that we vote, our health is involved with this. And who is the best trusted source of information is us as healthcare providers. Because of this, and understanding the importance of social determinants of health and the connection with civic engagement, we had the pleasure and opportunity to have more than 17 points of voting inside of AltaMed. And that could be actually you go and vote, or you can actually have a dropout of your ballot. These opportunities were amazing because we had a patient that came and was coming for the vaccines for their kids. And at that moment, we could engage them. And apart from giving that vaccines that will prevent a lot of problems, we were opening opportunities to be represented and heard. That's why I challenge you. I am going to leave you homework. Go and knock on the doors of your systems. Ask them that you want to be involved with civic engagement. It's not just about voting. It's about being represented and actively voicing out the concerns of our patients. We have all heard the stories. We are part of that story, and we're most importantly part of that community. We have the opportunity to make a change. Moving from that 20, 30 patients a day to hundreds of thousands. And everything starts with you, with the opportunity of knocking on the door. And yes, there will be budget questions and human resources questions and document questions. But I can tell you for sure that the moment that you start moving that needle, it could be just having your vote ER QR code. It could be adding texting to your patients, adding things at the moment that you discharge a patient from your clinics. It's a menu. It's a rainbow of opportunities of the things that we can do. But me personally, I want to be out there. I want to knock on the doors. I want to be part of this amazing movement led by these amazing leaders to make sure that my community has the opportunity to be better, to create a healthier future, and also to be heard. Thank you so much, and I invite you to send us all your questions. We're always here for you.
Well, thank you to Dr. Shapiro. Like I said, we could learn a little bit more about our program at myvotemyhealth.org. We are planning tons of events for August Civic Health Month. So we invite you to join and be a partner with VoteER and climate and voting for climate and health in this August Civic Health Month. I know we'll share the presentation, but here's just a kind of a baseline. So start thinking on how to get involved. As Dr. Shapiro said, it is a menu. So it's a buffet. You could pick where to start and to start to engage. So a big thank you to everyone, and I'll be here for questions. So I'll hand it back to Cynthia.
Wow. Thank you. Thank you so much, Cynthia. And that's so inspiring. Now I seem to have lost my slide deck. Sorry. Give me a moment here. In the meantime, Margie, why don't you take over and start talking about Civic Health Month and what that's going to involve. Margie?
You're on mute.
Oh.
There, sorry. August is Civic Health Month, yay. And what is Civic Health Month? Civic Health Month is a way to get our institutions involved in promoting civic engagement and wellness for our own healthcare communities. And as an ambassador to your institution and administration, you can help define what you can do to promote community wellness. I'll give you a little history about VoteER and Civic Health Month. VoteER started in 2020 at Mass General Emergency Department.
Sorry, are you still trying to share?
I'm just getting it up, thanks.
Oh, okay, I couldn't tell.
Yeah.
I can just tell the story. The individual providers were frustrated that the care that they provided did not address the social and structural issues that brought the patients to come back over and over again. The VoteER badge leads patients to register to vote. Now the power of the vote has been recognized by healthcare institutions, major medical societies, and hospital systems like the AMA, the American Academy of Pediatrics, and the American Nurses Association, to our Civic Health Month champions. The medical students have jumped on board. The Medical Students for a Sustainable Future, the Asian, Latino, and Students of Color Medical Student Associations are partners and champions. I wondered in California how many institutions take part in Civic Health Month. And alas, in California, there are only 7 institutions that are partners. We have represented from La Clinica here, and La Clinica is a partner. But we do have AltaMed as our only champion and what we all can aspire to become. And with your help, we can do better. Great.
There we go.
It's not showing, actually.
Oh. It's not showing again? Resume share. Let's try that.
I was going to talk about, is it legal to do voter registration in healthcare spaces? And the National Voter Registration Act of 1993 actually states, and I quote directly from the document, any office in a covered state that provides either public assistance or state-funded programs must offer voter registration services. That means any office that provides Medi-Cal, Medicare, WIC, SNAP, et cetera, must offer voter registration services. When patients use the VoteER tool, they are voluntarily entering their information using their own devices. Therefore, these activities are not subject to HIPAA regulations. Next slide, please. What is required of a Civic Health Month partner? It doesn't take much to be a Civic Health Month partner. All you have to do is to commit to one of these easy steps. And it can take as little as having your administration email staff members and employees to encourage voter registration. And we have templates they can use. Your admin can add important voting and election reminders to your organization's calendar or newsletter. It's easy to display posters or provide one-pagers for patients, and all this is downloadable from the VoteER website. Your institution could also become a Civic Health Month champion like AltaMed. Champions lead the way to incorporating civic engagement as the norm in healthcare. VoteER offers tools and next, last
Oh,
slide. VoteER offers tools and resources. There are a variety of downloadable graphics on the VoteER website. There are posters, handout, flyers. There are slide deck presentations that you can give to your administration. And VoteER provides a template for your administration to send out in a newsletter or email to staff and employees about voting. There are VoteER badges that now over 30,000 health community workers are wearing to register patients to vote. And now Cynthia is going to show you how you can take action.
All right, great. Thanks, Margie. So actions we can take today. First, we ask you to check your own registration because the bad, sad news is doctors vote significantly less than others for whatever reason. So if you take a moment, scan the QR code here. This is the same one that's on the VoteER badge, and we'll give you just about a minute to see how easy that is to do. If you aren't able to scan right now, don't have a camera, then the link will be in the chat.
Yeah, it's in the chat.
And you'll see on that site, you can check your registration, and don't assume that you are registered because many people may have moved or there's a lot of purging in voting sites, registration sites. So do go ahead and check. And if you scroll down that page, you'll see you can register, check your registration, register, find information about upcoming local elections, and get voter help. So it's a great website, nonpartisan. And
I think that's good since we're running a few minutes behind.
okay, so you can finish that up later. The second thing, we're going to ask you to get your own VoteER badge, and I'll show you where you can do that on the website. It's super easy. But our main ask today is that you request your organization join Civic Health Month. And I'd suggest you start by finding one or two allies. You might find someone in your institution that already has a VoteER badge. You know they're on board. You might find someone who is on the sustainability or green team, or maybe somebody who's in pediatrics or GYN whose societies are already VoteER partners and encourage this. Then review the Civic Health Month site that you're going to ask your administrator to sign up for. And we'll run through that super quickly, just so you can see how easy it is. You want to be familiar before you ask them. And then request a meeting with administration, and we'll provide a sample email. So if you go to the voteer.org site, read across, you can either click your VoteER badge here, and under Get Started, you can download a badge because it takes a couple weeks to get one from the site, and other resources. But for Civic Health Month, go all the way over to Programs and the drop-down menu Civic Health Month. And then you'll see this screen, click Become a Partner here with the red arrow, and then click Sign Up. Your administrator will be asked to answer whether they're a new organization, what type of event, which they may not know. So you can just say, I don't know yet, or other, I want to put up posters and email staff. Say it's just for your institution, check you don't know when you're going to start it, check yes for additional support from VoteER. And then they just fill in the name of the institution, the state, their logo, and what kind of patient population they serve. And then put in their contact information and whether they're an administrator or a department head, and click Submit. So that's the nuts and bolts. It's pretty easy. And then we have a sample email for you to request a meeting, and you might want to have this signed by several people, your allies, just asking to schedule a 10-minute conversation to talk about partnering and why it's good for the organization. Let me just double check my notes here. Right. So with that, I hope that you will take a moment to just think about who your allies might be and commit to a time in the next week when you could send a message to your registration. And with that, let's turn it over to our panel for Q&A. Karina?
All right, thanks so much, Cynthia. So it's time to hear from our panel and answer any questions that anyone might have. So I'd like to welcome back two of our speakers, Gnora Gumanow from Healthy Democracy, Healthy People, and Cynthia Romo from AltaMed. And we're happy to also have Maria Bobrowski-Artola join, who is the Policy Partnership Manager for VoteER. So welcome to you all. I don't know if anybody wants to speak up with a question, but I'll get it going. I think a super common question that people have that's either spoken or unspoken is institutions, clinics, they want to know what's in it for them, what will it cost them, is it legal, what resources will they need, you know, what are we asking of them? So maybe Cynthia, Romo, you could start. And
Perfect. I'll keep it short. These are the same questions we had in our organization, of course. One is having leadership actually buy-in for this. And then from there, looking at your own internal civic engagement champions. They will come out organically, I'll be honest, and you have those colleagues that really want to get the word out. And two, what's in it for us as a community health center? It's the health of our communities. It's the future of our community. So it's not just speaking up during this election, or let's say being even counted in the census or redistricting. It's beyond that. It's really advocating with and for our communities. And there's only so much we could do within our exam room doors. As Cynthia M stated, 80% is that affects our health is outside. So we need to really start focusing and integrating into our clinic processes these opportunities for engagement. And I will say, with different partners that we have here, there's tons of resources that are turnkey resources that you could use, a toolkit, social media toolkits. That's not a very heavy lift to start. And of course, all of this is C3 compliant, so non-partisan compliant. And I think that's the best message to say. We're not telling you who and what to vote for, but we are telling you to vote. And these are many conversations I get with our community and our staff is, well, I don't know who to vote for. And I said, you're the expert. You know your life, you know your community. So you represent the community. So you know what to do in that. So again, it's taking small steps. You don't have to take, as Dr. Shapiro said, the whole buffet. You don't have to taste everything, but just a little bit here and there, and then moving on. But the best thing is to not be sporadic. It has to be continuous engagement. Even small efforts have a huge impact and outcome in our communities. So don't count yourself out if it's only, you know what, I'm taking step one, let me sign up to become a partner for Civic Health Month. That's a huge step, by the way. And the tools are there so they can be replicable and scalable.
thank you, Cynthia. This is coming from an expert, so everybody should be listening up because AltaMed is the shining star for this. So Maria, did you want to add anything to that? And also what sort of resources Vote ER provides and what people might need?
Absolutely. I'm happy to share more on the resources that Vote ER provides. I think Cynthia did well in covering a lot of the other concerns folks have when really stepping into this work as partners and champions. And at Vote ER, we have a ton of free resources, from the actual tools that you can use as a provider, like that lanyard with the QR code to just engage in the conversation with patients, to other digital resources that are completely free. I know you all saw some posters that can hang up as patients are waiting in the exam room. It's a very great time to take advantage to just scan a QR code and check voter registration. In our virtual world now, as we've become accustomed to a lot of Zoom meetings, unfortunately don't have mine to display right now, but we do have Zoom backdrops that include that QR code and include access to links for Vote ER tools and resources. As we are gearing up for Civic Health Month, Vote ER has over 10 different training webinars that we are doing in collaboration with partners and that we are hosting throughout the entire month of August, ranging on resources and trainings of how to host an actual voter registration drive at your institution, to explaining the whys and hows to pass a proclamation or resolution to promote civic health. So we have a bunch of trainings that are free and that we encourage everyone to attend, in addition to our huge conference at the end of August.
Super.
Yes.
Thank you, Maria. I don't know, Nora, if you're wanting to have any last thoughts or anything to add, or you're good? Are there any, we have maybe 30 seconds left, like the main pushbacks or points of resistance that someone might encounter when they're trying to get this going? Either one, I don't know, Cynthia, if you wanted to.
Sure. The main one that we get is I don't have time. It's the bandwidth is very thin and and we understand in healthcare. But that's why these tools and these models have, we talk about feasibility and integration within the clinic processes. And it could be as simple as the VOTIR VR badge that actually I have and I should have been wearing, that it's a simple 20-second, 10-second conversation. And again, just that 20-second conversation can change the life of that patient, of our community, and it has these rippling effects. So that's the same one. If I don't have time, it's like we have a little bit of time. This is important.
Yeah, it's super important. I think we all were learning that, we're underlining that. So thank you so much, everybody, for your contribution to our panel. And I'm going to hand it back over to Cynthia Mahoney to finish up. I have to figure out how to oh, there. Thank you.
Okay. Well, thank you so much to everyone, to our wonderful speakers. I wish we had more time to share a discussion with them, but we're trying to get people out on the lunch hour. I want to thank our team, Jennifer Graber, Eve Yalom, Vanessa Forsyth, and Janet Perlman. And most of all, thank you all for attending. I hope this has inspired you regarding the power of healthcare-based civic engagement and enabled you to help your institution take the first steps. Because the only way we'll solve the health and climate crisis is together. And health has a powerful role because of our trusted voice and our connection to the most vulnerable patients. So if you like what we're doing, we're looking for 4 or 5 people to join our teams. Please connect with us. We're available for presentations. And if you know anyone who or other groups we should look to ally with, let us know. And I want to give a shout out to Vote ER's Civic Health Month conference coming up Friday, August 25th. You can register with for that if you'd like. So thanks so much, everyone, and have a great rest of your day. Stay healthy, and let's work together for our patients, our communities, and a life-sustaining planet. Thanks so much. Goodbye.
Thank you. Bye-bye.